My name is Dr. Charles Laham. I'm an interventional cardiologist and general cardiologist that also works on leg arteries and peripheral arteries and has a good working knowledge of the majority of problems in cardiology, but also a big interest in nutritional care and how to optimize general health in addition to cardiac health through better dietary choices. I've been fortunate to work with some of the leading experts both at Mayo Clinic and at the Midwest Cardiovascular Research Center and in UCLA at the Movie Star Hospital and at Hackensack Hospital in New Jersey. Having seen the whole spectrum of practice, both in the veterans hospitals, in the Canadian medical care, in top executive care at some of the bigger centers in the East Coast, I've had a chance to realize that patients all have the same working parts when it comes down to it, no matter how famous or unfamous that they are, and that they need to have every part of their care looked at very diligently and to the nth degree. That sometimes thinking outside the box and taking a closer look at things, that occasionally there are things that are still correctable that need to be looked into a little bit more thoroughly. And unfortunately that takes time, so I pride myself on taking as much time as the patients need. Empathy and sympathy and relatability makes it a little bit easier for them to open up about some of the issues that they have a difficult time expressing because they might be embarrassed or they might be feeling that it's too small of an issue. There's no such thing as an issue that's too small to discuss. But most people understand, when they take their car to the garage that they want this, this, and this, and I think that it makes it easier for them to understand the difficult concepts in cardiology when they know that the motor isn't running or the cylinders aren't as good as they should be or that they need their head gasket repaired and that they shouldn't be worried about a couple of dents in their fender when there's bigger issues. I grew up in Winnipeg in the center of Canada, but I've been throughout all of the provinces. I've been, in the Midwest for the last 20 years for the most part, and have spent 15 years of that time in Wisconsin, and also spent 3 or 4 years in Rockford. And Beloit was a good transition for me to be close to family and friends and the same values that I've been used to working with patients. And the climate is not so dissimilar than Canada.